I think the most important thing that I want to emphasize to patients with Sjögren syndrome is that for the majority, it's a disease that stays relatively stable over time. So when they ask me what are things going to be like in 5 years or 10 years, I can tell them with reasonable certainty that things aren't going to be all that much different. They need to pay attention to managing their dry eyes, to managing the dry mouth so that they avoid complications that can ensue such as corneal erosions or dental decay. But if they do take meticulous care of their eyes and mouth, they can really have a normal lifespan and what I hope to be a normal life. Any patient with rheumatic disease, particularly when it's systemic in nature, requires some attention to having a balanced lifestyle where one gets plenty of rest, one eats well, one gets a judicious amounts of exercise. And when you pay attention to those balances in life, I think most people with rheumatic disease can live quite normally. In the United States, we are fortunate to have a very active Sjögren Syndrome Foundation, which is a national organization that's devoted to helping patients live with Sjögren syndrome. So I urge all my patients to visit their website, www.sjögrens.org. And there's a variety of materials on the website that can be very helpful in terms of how to manage daily symptoms, talk about the disease, to have copies of newsletters, and to learn a lot more about the disease. There are also a number of support groups locally that patients can participate in to learn more and to share their concerns with other patients who have the disease.